Good. Wiggle those toes. Where'd you feel most of that? Okay. So today's visit number 2. You came in from as far as Fiji for the RingDinger. So tell me what's different from the morning to now. And it might not be drastic. It might be subtle.
It's subtle. I mean, I had a lot of numbness on my feet.
Okay.
It's been reduced by about 40%, I would say.
That's a lot in one visit.
The numbness.
Okay.
Of course, I've got some pain on this side.
Right.
From the RingDinger.
Right.
But I don't expect.
But you're with us for a couple more visits.
I don't expect a solution in one day. That's why I'm here. I flew in just for this.
Right.
On my way to Europe, for 4 days.
All right, let's do it. We're going to be laying on our back first. Butt goes there, feet goes there. Flat on your spine. So as far as Fiji, I think that's the furthest someone.
I came from Fiji.
Gotcha.
Yeah, but I'm going to back to Europe.
Europe. Yeah, we had people today. We had some husband and wife. They flew in from, move down for me, Turks and Caicos.
Oh, yeah, that's far.
So that's far.
That's as far as Fiji, I think.
Yes, sir. All right, and for the people watching this video, yes, we're in New York City. You could hear the horns honking. It is New York. All right, move down. Good, right there. All right, so I'm going to put this pin right above that hip. And remember, this is designed, move down a little bit more down. It's designed to be tight. Okay.
I don't have breakfast, but it's beautiful.
Oh, did you go have breakfast?
Yeah.
It's 2 hands?
Yeah.
Was it good?
Yeah.
Yeah, 2 hands a good place. Relax the hip, don't help me. Breathe in and let it out. All right, good. Now, let me see the hands here.
So already I feel pain on both sides.
Okay. Interlock your fingers. So what happens is these pins will hold your pelvis in place. When we pull, your pelvis will bump into those pins, and it might feel bruised and uncomfortable for a couple days. Mm-hmm. Pick your head up, put it down, and put it down. And then today, we just did this a couple hours ago, yeah. So of course it's going to be a little sensitive. If it is a little arnica, a little ice. Okay. So remember, breathe in and out. Good, breathe in again. And all the way out. Good, wiggle those toes. Where'd you feel most of that?
Right here, all over.
In the legs?
Yeah, I just feel a light.
Lightning?
Yeah. Ooh.
Catch your breath. That's why you're here, right? Okay, catch your breath. Did it subside a little bit?
Yeah.
Okay, that means we're affecting the nerves. Like shooting down.
Yeah.
Yes, sir. Breathe in for me. Stop this head, rotate. We're gonna go occiput, C2, 3, 4. Drop this. Good. 2, 3, 4, 5. Drop this. Good, stay right there. Nothing too crazy. Okay. All right, so what we're gonna do is wait till this comes to a complete stop. Then you're going to turn your whole body facing me. Wait there for a second. Don't move just yet. Might be a little lightheaded. But if I have 40% reduction in the nerves, that's good. Stand up and...
here, this...
Yep, stand up for me. How's that feeling now?
Okay. Bit of pain on this side.
Let's go on your stomach, face down. Relax these feet. All right, so if you look, when we start, we have a right short leg, and we go up into flexion, and it crosses over. That's a lot better than this morning. All right, is this less pain when I do this?
Yeah.
Less pain, okay, good. So we're gonna, again, stick primarily with the drop technique.
So there's sort of pain
on that right glute. 1. Breathe in and relax. 1. Down. 2. 1 more. Down. Good. Good. 1. 2. L4. 3. 2. Good. So yeah, long distance to come in and get treated. I think you break the record. We did have one guy come from all the way in South America, like the bottom of South America. So just do a little flexion distraction. Opening up that lower lumbar. And you know what? Being that that lower right side is hurting you a lot, we're going to do a side adjustment on that on you. Okay, I want to get that to move. Right side. All right. So what I'm going to have you do is you're going to be laying on your left side of your body. Your sacrum is pretty stuck. Breathe in. Oh, don't help me. Air out. Drop this. Drop this. Got it. All right, on your back, flat. Woo. Okay, now we're going to unload this side. Let this relax. There we go. You felt that release in the knee? That's it. Ankle. Drop this. Good. Elbow. You know, the most important thing is if you feel like you're standing taller, lighter, and you can move better. So stand up for me, carefully, nice and slow. What's going on with the nerve pain?
Well, still have it here.
Show me. The right glute, okay.
Yeah.
And that's where it always was.
Well, it was on
Left.
both sides.
Both sides. Left side's better.
The left side is definitely better.
Okay. Try walking. Let me see you walk down the hall and back. All right, still bumped out to the right side. Looks like less of a limp. Now walk back. Walking better.
Yeah.
So now I'm going to do some muscle work on that right glute. So I'm going to raise this up. Kind of right in here a bit. Or more like right there.
Yeah, right.
Okay, so bend this knee. Relax his hip for me, okay? So working on the glute and the piriformis a little bit. If it's too much, let me know. Right here. Yeah, so this muscle is a muscle that chronically gets tight. And I'm just doing some soft tissue work. Not so much here, right? Not as bad right there? But more like, would you say, right here? Okay, good. So it's more right there. And this knee. Right short. Long, stays long. Okay, good. I'm going to have also, before you leave, we're going to put you on some electric stim just to loosen this glute up because your glute's so tight. Like lift it up from here. Put it down. Now do the left one. Put it down. Now do the right one. See, a lot harder on his right side? Okay, pick this leg up. Cross it over. Put it down. Relax his butt down. I'm going to shift you from right to left. No, that's wimpy. 1, 2, 3. So this is a sacral deviation adjustment. You don't see me doing this all the time. I go from here. That's not too painful, right? One more. Good. Uncross that. Now lift that right leg up. Wow, got some work to do with that, huh? How long has it been bugging you?
Quite some time.
Quite some time. Still sensitive right there? Right in here. Right there. Okay, so I think what we'll do, what's best, is we'll get up, we'll put you next door, we'll put electric stim right on his glute with a little ice, and then you're back here tomorrow a couple times. Okay. All right, good. Stand up, let's go next door. So this is a second visit for a patient that flew in all the way from Fiji to get treated with the RingDinger protocol. What we did is we did a full spine, a chiropractic biophysics adjustment, followed by a Y-axis manual spinal decompression pull. Actually, in the second visit, we started with the pull, and then we did a full spine. And then he still was a little tender and sore, so we did electric stim right on the glute with some ice. and we followed up with some deep tissue laser, and we also did some cold laser to help decrease inflammation, and we did some class 4 laser on his shoulder. So there's more to the practice than just chiropractic. We also like to evolve modalities that not a lot of offices have, like cold laser or deep tissue laser therapy, and we also have the traditional physiotherapy modalities like electric stim and ice. So his shoulder, he had a rotator cuff tear, and what we found that works really well is class 4 deep tissue laser for reducing the shoulder pain, improving the range of motion. On his lower back, he's dealing with sciatica that has been there for years, and if you could see in the video, he's walking with a little bit of a limp, and he had numbness in the top of both of his legs. And after the first adjustment, he reported that he had a 40% reduction in his symptoms and had better sensation in the bottom of the legs. So we've seen patients with terrible sciaticas respond really well to only a few y-axis manual spinal decompression adjustments and the lower body decompression adjustments. This is only visit number 2. He's here with us for another couple days, and we'll continue to update videos on his progress. Like I said, people travel long distances to get really good care. If you're watching this video and you're on the fence about whether you need it, give us a call. We'll get you in and we'll get you better.